Okay, so we talked about heart rate. Next thing we're going to talk about is oxygenation. Oxygen, of course, is the molecule that we need to live. Sometimes you'll see it with an O2, because two oxygen atoms combine together to form an oxygen molecule. We learned during our anatomy session that oxygen is carried through the blood primarily on hemoglobin. Hemoglobin, of course, is the protein found in red blood cells. The red blood cells are the cells within the blood that transport primarily oxygen from the lungs to the distal portions of the body, and so it carries out metabolic activities. So oxygen is transported through the blood, and so as we look at ways of measuring the amount of oxygen, we do what's called a pulse oximeter, or pulse oximetry is another way of saying that. So we use a pulse oximeter to measure the pulse oximetry, I guess is the way of saying it. Sometimes you'll hear pulse ox, because it's usually saying, what is the pulse oximetry reading? You say, well, what's the pulse ox? Because it's quicker and it's easier and it just nice and quick. So pulse ox. When we talk about pulse oximetry or pulse ox, there's a certain level that we want to have it greater than. And what's that level?
96.
So for ACLS purposes, greater than or equal to 94, because throughout the course, the definition for low oxygen levels in the blood is less than 94%. Okay, and we use the term percent because it talks about the percentage of hemoglobin that is saturated with oxygen. So 94% of the blood is saturated with oxygen. So when we're getting to especially low, people start to really get concerned less than 90%, less than 88. Usually if you're getting to be that low, you really need to be giving the person oxygen, because getting below 88 is when they really start to, something bad is going on. If it's getting to be like around 70%, that's when the person is not breathing and they're about to die. So generally, greater than or equal to 94% or less than 94% is the value that we want for pulse oximeter. That measures the amount of oxygen in the blood. Pulse oximetry. So during your oral surgery cases, sometimes you might see something called this. Does anybody tell me what EtCO2 means?
It's the exhale, like when they exhale?
Exhale.
Respirations?
The expiration, and what is it? And what is the substance that's being exhaled?
Carbon dioxide.
Carbon dioxide, CO2. C for carbon, O2 is dioxide. 2 is the di, because there's 2 oxygens per carbon atom. And so a molecule of carbon dioxide. Carbon dioxide is also carried through the blood, primarily dissolved in the blood, but a small, like maybe, I think like 2% is carried in hemoglobin, but most of it is dissolved either in the blood plasma itself or carried as something called bicarbonate. But that's not important for this class. The important thing is carbon dioxide is a byproduct of normal metabolic activity in the tissues. This carbon dioxide absorbs into the blood, travels to the lungs, diffuses across the blood capillaries into the alveoli of the lungs, and is exhaled out. So as you breathe out, you're breathing out a certain amount of carbon dioxide. So ET specifically stands for end-tidal, because tidal refers to the breathing in and out motions. So at the end of the breath is the end-tidal and the amount of carbon dioxide. And this is measured in millimeters of mercury. Okay, so the end-tidal CO2, and when you see it on your machines, it kind of looks like this, right? Something like that. I can't really draw very well. But when you look at your end-tidal CO2 devices, this is kind of the breathing pattern. And so generally, for a normal breathing person, what would be the end tidal CO2 value which you would consider to be normal? Do you know what the number is?
16?
No. Maybe 40. Okay, so generally a value of about 40 is kind of what you're shooting for. This is a number that you're going to have to memorize and know for the next 3 months. This value, 40, for your end tidal CO2. Because that's going to be the number when you're talking about after you've resuscitated somebody after a cardiac arrest. One of the things that you're going to be looking for is an end tidal CO2 value of 40. Okay, that's your number. On the other hand, if somebody has intubation, they have an endotracheal intubation, that's the tube that goes in to help them breathe directly into their trachea and their lungs. There's a certain end tidal CO2 value that you want to aspire for as you're doing chest compressions or CPR. Does anybody happen to know what that number is? We haven't gotten that far yet, but the number that you're looking for is 10. Okay. So if you're doing chest compressions and you have end tidal CO2 monitor attached, you can judge the effectiveness of chest compressions based on the end tidal CO2 value, and you want it to be greater than 10. Okay, if it's less than 10, that means you're not doing effective CPR. So end tidal CO2, the numbers you want to know is 10 and 40. Put that in your notes, tuck it away, memorize it, because it's unfortunately not going to be going away. All right. So far we talked about the blood pressure, we talked about heart rate, we talked about pulse oximetry, we talked about end tidal CO2. Are there any other vital signs that you think are important during ACLS? Well, sometimes you might hear the respiration rate. So in a normal person, that's like for you right now, you're sitting here quietly, normal respiration is approximately 12 to 14. Sometimes, if you sit and you try to count, maybe it'll be 16. But if you're getting to be 18 to 20 with your respiration rate, you're starting to get a little bit fast. In ACLS, you might, part of the scenario might be their heart or the respiration rate is 30. Well, that's fast. Okay. If the respiration rate is less than 8, then that's abnormally slow. That's probably more important when you're doing your sedations. Like, for example, if you're over-medicating with narcotics and the respiratory rate is going to be like 4 or 6, you might want to kind of start to reverse the effects of the narcotics with them. Okay. Other vital signs is not so important if there's anything else. I can't really think of anything besides that. So the other thing that we want to talk about, and this is probably the most important part, is stability versus instability. Okay, this is the thing that I found has caused the enlisted folks the most trouble when they're taking the ACLS, is recognizing a stable versus an unstable patient. Because when you're doing your ACLS protocols, a stable person, you're probably going to do maybe some more testing. You're going to kind of keep your hands off a little bit compared to somebody that's unstable. Somebody that's unstable with the tachycardia, so their tachycardia, their heart is beating really, really, really fast, and they're exhibiting signs and symptoms of instability, you're going to want to intervene right away, because if they're unstable, they're going to eventually potentially die, and that's the person that you're going to want to move fast and intervene with. If somebody has a tachycardia heart rate of maybe 170, 180, but they're stable, maybe you'll step back, maybe give some medications and keep a very close eye on them in case they do suddenly become unstable. Instability, we'll want to talk about the vital signs, of course. Primarily is the blood pressure, right? So systolic blood pressure of less than 90. And so when we talk about an unstable patient, it's because their blood pressure is primarily because their blood pressure is low. The low blood pressure will then lead to things like low oxygenation, and the low oxygenation and low blood pressure will develop a series of symptoms that you can assess the patient with. Okay? Can anybody tell me a good method of clinically assessing a patient? You in the back?
How about in Washington? When we learn about how to assess somebody.
Oh,
They're
so
sick
you
or
would
not
start
sick.
with pretty much top to bottom. So you ask them if they're dizzy. I think it's when, like, if they're sweating. Would
Okay.
that be one of them?
Yeah,
If they're
that's
dizzy,
right.
Sweating.
Sweaty?
You would ask them if they could like see, is their vision blurred.
Okay.
I forgot that.
Can you guys help them out? So basically, you know, head down. So head, confused.
Okay.
Confused, which is called altered mental status, right? Confused. Are you sweaty and clammy looking, or diaphoretic? Okay, that's a word, you know that word. Diaphoretic, okay? So confused, diaphoretic, you can't see straight, you can't breathe very well, so you're going down, I can't breathe, my chest hurts, and I just feel sick, and I'm falling over. But just think about it. If I look at Martinez over there, and he is all sweaty and kind of going like this and stuff, it doesn't look very stable, just by looking at him, you know? If he's like, I don't know where I am, his head's not right, it's not stable. So think about, you're just sitting there, is he confused, the eyes blurry, are they all pale and sweaty? And the key there is altered mental status, which means confused, and diaphoretic. You're gonna see those two words, and you're gonna see them during the class and probably on the test. So altered mental status means confused, and diaphoretic is kind of sweaty and light clammy.
Yep. So I have them written down here on the little whiteboard. Confused, diaphoretic, sweaty, chest pain. So the chest hurts. Generally feeling sick is, you can say the word malaise. Malaise, you just kind of feel crummy. Nausea, of course, and then skin pallor. So somebody looks quite pale. So usually they'll say pallor with diaphoresis. So they're cold, clammy, white, pale, and sweaty. Is kind of the symptoms that somebody's going to have. Generally, somebody has an abnormally slow heart rate or bradycardia, and the heart rate is 40, and they're having symptoms of that. They'll say, oh, the person presents to you confused with an altered mental status, diaphoretic, with a heart rate of 40 and a blood pressure of 80 over palp. Okay, so when you hear that little story right there, the person's unstable. Comparatively, they'll say, well, the person has a heart rate of 42, it feels a little bit of chest tightness, but he's alert, oriented, he's talking to you in full sentences, you look at him, he looks well, he's wondering what the big deal is as everybody's rushing around to see why his heart rate is 42. So that's the stable patient. So unstable versus stable. And that's the key as you're going along and you're starting to go through the cases, starting to see some things. You want to say, is this person sick or are they not sick? Because it's a very definite, if they're sick, if they're unstable, you need to go do this. And if not, you just follow this algorithm. Okay. Do we have any questions about that? Okay. The last thing I wanted to talk about is the difference between ischemia and infarction. So we have two terms. One is ischemia. The other one is infarction. Can anybody tell me the difference between myocardial ischemia and myocardial infarction? Anybody know the difference between the two? Myocardial, of course, refers to the heart. Ischemia means the heart cells are dying, usually for a lack of oxygen. So for the heart itself, so you got your heart, you've got a blood vessel that comes along like so. This here artery is feeding the heart muscle, and all of a sudden there's a little bit of a blockage right there. Blocks the blood flow, blocks the oxygen, and so this little area of the heart here starts to die. That's ischemia.
And you said lack of oxygen?
Lack of oxygen, essentially. So the tissue itself is starting to die. So you might hear a term called ischemic chest pain. What that basically means is chest pain due to ischemia of the heart muscle. Sometimes people might call that angina. So maybe there's a temporary blockage in the vessel that's feeding the heart. So the little area of the heart there is not getting enough oxygen. It's working a little bit too hard. What happens if you're exercising a whole bunch? You don't have enough oxygen. You're gonna stop exercising, right? Same thing with the heart. This little area of the heart won't move quite so well. When it does that, there's pain sensors on there, and you'll have ischemic chest pain because the heart muscle is starting to die. Who could tell me what ischemic chest pain feels like? Maybe you've heard some terms.
I think like goes like all the way kind of into your face and like your neck and stuff.
Yes, so on the left side or right side?
I don't know.
Left side.
Left side, right? Because the heart is generally towards the left side of the chest. So you'll feel pain shooting down the arm and then up into the jaw, right? So that's the classic ischemic chest pain. So they'll be like, oh, kind of like they'll have this pose. The other thing is they'll take their fist to their chest and they say, this is like, oh. And they'll say sometimes, I feel like there's an elephant sitting on my chest because there's a lot of tightness and pressure. That's ischemic chest pain. Now, people can have chest pain for a variety of reasons, maybe acid reflux, or maybe their chest wall hurts, or there's something else going on. But ischemic chest pain is specifically referring to death of or dying heart muscle. If it crosses that point of no return and the heart muscle actually dies, that's infarction. And so you hear the term myocardial infarction, which is also, MI. Sometimes you hear that term. The lay term for that is heart attack, right? So myocardial infarction just basically means that area of the heart muscle has died generally because of a little blockage in the vessel. So myocardial infarction. Sometimes you'll hear AMI. A means acute myocardial infarction. Acute, of course, means suddenly or within a very short period of time. Acute myocardial infarction. And then later on in the course, you'll hear about something called STMI, STEMI, and it says ST elevation myocardial infarction. That's a specific term on an EKG, but that'll be here in a couple of weeks. You'll learn about STEMI, or ST elevation myocardial infarction. Okay. So, difference between ischemia and infarction. So one of the things that you might notice in somebody who is clinically unstable is chest pain, and that's specifically talking about ischemic chest pain, ischemic chest discomfort, because for some reason the heart is not getting enough oxygenation, and the heart muscles themselves are starting to die off, and that'll cause this particular ischemic chest pain. That's part of being their symptom of instability. Do we have any questions about that?
You said infarction is what?
Infarction is the actual death. Dead muscle.
Remember?
Ischemia is
like my
dying
joke.
muscle.
That heart is worked. See, she liked it.
Okay, this is on video, right?
The people on the video will appreciate it.
All right.
So we're gonna cover meal real quick.